Hi, so today we're gonna do a chemical peel. Before we start that, I just have had a lot of questions asked about my background and obtaining products unlicensed. So a little bit about me. I'm a nurse practitioner. My background is in critical care medicine. I've been working for 11 years in that field, and I went back and did psychiatry. Finished in 2015, so I do work a little bit in the psychiatric field as well. And then this aesthetic stuff started as a hobby, and it caught on. My mom and my sister are artists, so that's, I think, what drove me and brought out my art with medicine. Um, you need at least, at the very minimum, a registered nursing license. Beyond that, it's state to state what you can do as a nurse practitioner. As far as I know, there is no way to obtain, these are considered medicines, there's no way to obtain them without a license. So I am no longer going to be answering questions related to how one can obtain products without a license. And this is just a sampling of a little bit of what I do. It's not a training video. It's not intended to train. It's nothing like that. It's not, I don't condone doing this in your home on yourself. I do recommend you go to a trained professional who can do this, and it hasn't been until recently that I've been doing my own work on myself. It takes years of experience. You need to kind of know what you're doing in the facial anatomy and where certain arteries, veins, and all that is located with nerves, because you can do permanent damage to your face by doing this. So that being said, what we're going to do today is a chemical peel called the Perfect Derma Peel. This has a combination of glutathione, which is a good antioxidant for the skin. It has TCA, it has retinol, phenol, vitamin C, and kojic acid, all which help renew and rejuvenate the skin. My skin is going to start peeling after about 2.5 to 3 days. Until that point, I don't really want to moisturize it. I want it to get nice and dry, so it will start that peeling process. The more my skin can be dried and no moisture, it will peel better. I try to do this on myself like once a year or so, just to help rejuvenate and restore my skin. I do chemical peels roughly once a month, just to clean out my pores, because I don't have time to get facials, and I find they go a little deeper than facials tend to. And they also remove, the layers of the skin and rejuvenate the skin. So what I'm going to start out doing is clean my skin really well with, this is a peel activator solution I have. And I tend to go all the way to the base of the neck for this, so that my neck and my face are one color. I actually don't have any makeup on other than some eye makeup and my lipstick, so it's perfect. But the first step is making sure your skin is really clean. You want a clean palette for the peel to sit on. Peels are a good anti-aging treatment. Done in moderation, they're great. But again, you don't want to do this at home, because you can burn yourself if you're not versed in what you're doing. So that is now a clean slate to work on. The next thing I'm going to do is put a little bit of cream on the areas that tend to be more sensitive. So corners of my lips, around my nose, my skin's not very dry. In the winter, it tends to get dry around the cheek area. So I usually don't have a problem. It's combination, more so oily than anything. This peel has been manufactured well. It doesn't really sting much at all. It's available with a prescription, so you can't obtain it without having some sort of a medical license to write prescriptions. So I'm just gonna start layering this on layer by layer. First layer may tingle a bit. And the peel needs to stay on for at least 6 hours. It can stay on longer, there's no harm in that. But it needs to stay on for at least 6 hours. And then no makeup moisturizer for the first couple days, I recommend typically. The skin's gonna get a little red at first. And as with everything else, you want to make sure you get the neck. People often miss the neck when they moisturize. But the neck is just as important as the skin on the face. And all those little marks you see, like blemish marks that I have, there's one up here. These will all be erased in about a week. The course of this is going to take about a week until I get my full results. The skin will start peeling around day 3, and I'll keep some videos going so you can see the progress, and like clients of mine can see and follow along, so that when they come to get the service, there's now a video to follow, so there are no mistakes made. This peel comes with a take-home kit. Take-home kit has instructions, but you know, has sunblock, has lotions, has some treatment pads that are used for the first couple days. So there's nothing that needs to be purchased in addition to this. You can use your own moisturizers. If you start getting dry and itchy, you can use some hydrocortisone cream. But the whole point is to just renew the skin. This peel can be used for melasma, hyperpigmentation from breakouts, acne scars, scars in general, any sort of skin rejuvenation that is needed, sunspots, freckling, it will help diminish. Fine lines and wrinkles will get helped by this, but peels in general are gonna help with all of that stuff. And they're just gonna help clean your skin and keep it looking fresh. So that's the end of the solution. This is gonna sit on for at least 6 hours again. And then I can move on to using the take-home kit. I will be back to show you the results of my peel. Thank you for watching. Let me know if you have any questions.